So I want to welcome everyone again to the third part of the Understanding Addiction webinars that focuses on families for individuals who have someone in recovery or in addiction. So this one is titled Substance Use and Understanding Those Barriers. So addiction involves craving something intensely, loss of control over use, and continued involvement despite adverse consequences. Addiction is a complex brain disease that causes the inability to stop using a substance or engaging in a behavior, even though it's causing psychological and physical harm. Addiction causes the person to control their behaviors, have strong cravings, and often have difficulty using their emotions and having those emotional responses. And they also have difficulties abstaining from use. People can become addicted to a variety of things to include alcohol, drugs, shopping, food, sex, pornography, video games, and gambling. Nearly 23 million Americans, that's almost 1 in 10, are addicted to alcohol or another form of drugs. More than 2/3 of people with addiction abuse, alcohol. The top 3 drugs causing addiction are marijuana, opioids, and cocaine. Addiction is now understood to be a brain disease, whether it's alcohol, prescription pain pills, nicotine, or gambling. Overcoming addiction isn't as simple as just stopping or exercising that could greater control over those impulses. This is what is impacted when you hear about the reward systems and the pathways. One of the most significant parts of the brain is the reward system. And this is developed as a way to reinforce behaviors that we need to survive, such as eating. So when we eat foods, the reward pathways activates a chemical called dopamine, which in turn releases a jolt of satisfaction. This encourages you to keep eating and eat again. When a person develops an addiction to a substance, it's because the brain has started to change. This happens because addictive substances trigger an outside response when they reach the brain. Instead of a simple, pleasurable surge of dopamine, many drugs of abuse, such as opioids, cocaine, or nicotine, cause dopamine to flood the reward pathway 10 times more than a natural reward. This happens because addiction develops when the pleasure circuits in the brain get overwhelmed in a way that become chronic and sometimes even permanent. So next we're going to move into cravings. Cravings for our favorite things are common and one of the many things that makes us human. But if you're someone in recovery from a substance use disorder, cravings for drugs or alcohol can become strong, throwing a wrench into a person's plan to avoid relapse. Cravings are caused by triggers that provoke memories and feelings which are linked to substance use. And while some substance abuse triggers are avoidable, like a scene popping up in a movie of people using drugs or drinking, identifying and putting a plan in place to address them will help you cope with these cravings. Cravings are normal, common, and often uncontrollable urges that do not point to a person's moral failure. Just like someone who is on a diet who wants a piece of chocolate cake, cravings happen to most, if not to all, patients in recovery from substance use disorders. And if not properly managed, they can make avoiding relapse more challenging. There are 2 fundamental types of cravings you should be aware of. These types of cravings manifest as a physical response to your body. It can feel like your stomach is turning, your chest is tightening, and your muscles begin to ache. But then there are cravings that are mental, and these show up in your thoughts or emotions, like when we say, I need it now, or I can't stop thinking about it. Substance use disorders and drug use change the way our brain works. If someone is in recovery and experiencing a craving, you've taken them back to the time when substance use brought pleasure, and your brain pays no attention to all the ways that it caused it harm. Identifying triggers starts with knowing yourself and who you are and knowing those symptoms. Triggers are thoughts, feelings, and memories that remind you of your substance use or the lifestyle around your substance use. Brain scans have shown that these triggers are tied to your neurochemistry, activating the key parts of your brain that lead to the desire to use. These triggers can be different for everyone. Depending on your own personality and your substance use history, the following things may trigger a craving for you, which could be a special occasion or holidays, parties, sporting events, gambling, being around people you associate with substance use, being offered a drink or use a substance, being fatigued, stressed, free time or boredom, or watching a movie where someone is using your drug of choice. The vast majority of people who need treatment for substance use disorders do not seek it. Several barriers can discourage someone from getting help, and many people are deterred by a combination of factors. But there is no good reason an individual in addiction should avoid treatment. More than 20 million people battling addiction require treatment to recover. Some people can quit using alcohol or drugs with the help of family or friends. However, some people with substance use disorder needs professional assistance. For those individuals, addiction may be too severe or they're genetically predisposed in a way that makes it nearly impossible to quit without professional rehabilitation. Getting help for addiction isn't easy though. Withdrawal symptoms and cravings can discourage people from trying to quit. Many parts of society condone trying drugs, leading many people to hide their addiction. The National Survey on Drug Use and Health found that 39% of individuals could not afford or they did not have health insurance. 29% of people were not ready to stop using drugs. 18% feared opinion from neighbors or the community. 17% feared it would affect work. 14% did not know where to find help or where to turn to. And 8% did not think they even needed help. Sometimes people choose not to seek treatment for multiple reasons. For example, they may be afraid to tell their boss for fear of negative reactions, and they think they can't miss work or afford treatment in the first place. Decades of research supports common themes for avoided treatment to include cost, being in denial, the stigma associated with it, work, and lack of awareness or knowledge that treatment is available. Psychological characteristics, lifestyles, and environmental factors all contribute to these excuses as well. Many individuals who struggle with substance abuse do so alone, but it's not always because the person simply refuses to get help. There are some obstacles preventing people from seeking treatment, no matter how much a person wants to go to treatment. Some of the most common reasons that those struggling with addiction don't seek help and how they can be overcome. So this first one to seeking treatment is to recognize that help is even needed. Many people who suffer from addiction do not realize the severity of their problem until it's too late. And if they do recognize the problem until it's too late, perhaps they aren't ready to stop using, or they may have been affected for so long it completely controls their lives. Though our society is beginning to recognize that addiction is a disease, many people struggling with substance abuse may avoid getting help for that fear of the stigma that's unfortunately surrounding for those in addiction. If this person is still employed in an addiction, they may worry that seeking treatment may cause them to lose their job. Even if an individual wishes to seek treatment and help, they may be unable to find quality rehabilitation programs in their area, or they may be unable to access them due to transportation or scheduling issues. This means that sometimes a person struggling with addiction has to go a little further to find the care that they need. But one of the biggest reasons people don't seek treatment for substance use disorders is concerns about the cost of treatment. Many people believe that they simply can't afford to seek treatment. While some treatment centers have the reputation for being expensive, much of this perception is misguided and based on outdated preconceptions. In reality, it's more than possible to receive affordable treatment. In fact, an increasing number of health insurance plans now include some sort of coverage for addiction treatment. Family members are often desperately concerned about a loved one's drug or alcohol use, but they don't know how to begin that conversation with someone who's struggling with addiction. For many people struggling with addiction, they are often motivated to seek treatment by the care and concern of their loved ones. So it's important for family members to push through any discomfort that they may have about having that initial conversation for their loved ones and their addiction. And it's really important to remember to be supportive during these conversations and be non-judgmental. And you also want to be really specific about the behavioral patterns you've been observing over the course of their addiction and tell them that. And you want to be prepared to offer help. Substance use affects everyone in the family, so it's very important that family members are involved in the treatment and recovery process for both adults and youth. In fact, most patients engage in treatment because of the positive family involvement and intervention. Each family is affected by the chemically dependent person, and they go through the progression of the illness together. Each family member reacts with the survival behavior. That is behavior which causes the least amount of personal stress. Relapse occurs, and it's a part of recovery. Do not lose faith in your loved one just because they use again. Support them, understand them, and give them that direction and guidance that they need. You cannot stop anyone from using any more than you can force them to start using. Accept that and be there for them. That's all you can do. Your responsibility to yourself takes priority. You cannot help anyone if you're unable to take care of yourself. You have to put yourself first no matter what. One of the hardest and most important steps may just be starting the conversation. By no means do you have to be an expert or have the answers when you start this dialogue. Express your concerns and your willingness to listen and be there for that person. Don't be afraid to talk about it. Reassure them that you care about them and that you're there for them. And also educate yourself. The more you understand about conditions, symptoms, possible treatment providers, and what to expect, the better you're going to be able to support your loved one. So here within Firetree, we have a variety of programs that we offer. We have residential treatment, so that's our inpatient facilities. We have our halfway houses, that is our step downs from our inpatient treatment providers. We also have some outpatient treatment, so that's where an individual can go once a week, twice a week, 3 times a week, depending on what they are recommended. And we have residential reentry programs as well. And some of our treatment options that are offered here at our facilities focus on cognitive behavioral therapy, motivational interviewing, group therapy, 12-step programs, and medication-assisted treatment. So cognitive behavioral therapy, CBT, it helps people to develop alternative ways of thinking and behaving, which aims to reduce the psychological distress. Motivational interviewing, this focuses on giving individuals different alternatives to motivate them. So these are for individuals who have mixed feelings about being in treatment, mixed feelings about being in recovery. This technique is utilized by a majority of clinicians. Next, we have group therapy, and Firetree offers a variety of program topics. It focuses on cognitive behavioral therapy, co-occurring, our 12-step groups. We have positive thinking, relapse prevention groups, and this is all based on a particular topic. And medication-assisted treatment. This is the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach when treating substance use disorders. And lastly, I just want to provide you with some resources for family members. We have our Firetree phone number, our website, SAMHSA's national hotline, and some resources for Alcoholics Anonymous and Narcotics Anonymous. So that is the end of the presentation. I want to thank you all for joining tonight.